So we're going to demonstrate an ulnar gutter splint, which is most often used for boxer's fractures. So the small finger, ring finger, or middle finger often will have a fracture below it in the hand, or sometimes even at the knuckle, including the wrist. So these are very painful fractures, and often we'll find that the meat of the hand is very swollen. So you're going to want to be very careful with your patient. We'll apply our stockinette, following the same rule as our other hand splints. We're going to want to cut a hole for the thumb, being mindful that we need that thumb to have full rotation as long as the patient is physically able. So nice smooth stockinette here. We want to make sure that our stockinette is long enough past the tip of the fingers that when we fold it over at the highest point of the splint, you can just see the fingertips, and it still gives you enough cover over your splint. So an inch or so is usually adequate. Pull that forward just a touch. And we're going to measure for our splint. Depending on which finger is involved, you're going to want to ask the physician how many of these fingers they want captured in the splint. Most often we'll find that they just want the index finger and the thumb exposed and the last three fingers splinted. So that's what we're going to demonstrate. First, we're going to pull this back, and we'll need to get a little bit of padding between each of these fingers. We don't want them to be crunched together, and we don't want to promote tissue breakdown between each finger. So we'll just tuck a little piece of web roll between these fingers, which are going to be incorporated into the splint, and then we can cover that back up. What I like to do is cut down the index finger if it isn't going to be included in the splint, just to the base of the finger, so that this patient will still have range of motion. Once we've got this stockinette on, I kind of like to wrap it around the incorporated fingers just to make sure we have a boundary between that and the index finger. And then we are going to want to do some padding. So depending on the size of the patient's hand, you can use 2 or 3 inch web roll to do your padding, but the same layers rule applies. So we're going to want 3 layers of padding around all of the parts that are going to be covered in the splint. When we're doing padding, especially for an ulnar gutter and the other gutters, we want to make sure that when we go to fold the stockinette down, we're going to be able to see the tips of all of the involved fingers so that we can check for capillary refill, and also so the patient can check for it when they're at home caring for their splint. So we've got our 3rd layer on the fingers. We can start to work down the hand. Once I get to the hand, I like to go a little wider on the web roll, makes it go a little bit faster. You can tear it down and around the thumb to secure this web roll, but then make sure we're making nice and neat folds around the thumb so that we don't impair the range of motion later on. So we've got our layers on the hand, and we can go ahead and start padding the arm and the wrist. You want to be mindful with web roll that we're not creating big wrinkles. And if you do find yourself creating wrinkles, smooth them out and then start with a new piece of web roll. So we pulled that slightly taut. We want to make sure that we weren't creating those wrinkles. Looks pretty good. So we can go ahead and measure for our splint. When I'm measuring for an ulnar gutter, a couple things to keep in mind. Make sure with the patient that you didn't wrap the web roll so tight around the fingers that they feel that these involved fingers are being crunched together. So as long as the patient has enough space between their fingers, I measure from the distal joint of the longest finger that's going to be in the splint to a few inches between the elbow crease, or from the elbow crease. So just a couple of inches here, a few finger widths is where we're going to stop our splint, and this is going to be the length of our splint. Rock solid. So we measured our splint. And we've actually already gotten it cut. So when you apply the splint material, the orthoglass, to the hand, you're going to want to make sure that we form it properly. So we'll hold on to it with our stockinette on this end, and then when we turn over, we want the wrist slightly cocked up, and these fingers, the involved fingers, pulled down, leaving the thumb and the index finger to have their full and normal ranges of motion. We also want to make sure that our stockinette is long enough at the end here that we can pull it over the splinting material, even if you have to secure with a little bit of tape, and you're able to see the tips of all three fingers involved. Again, that's for capillary refill. So I've got the small ring and middle finger here that I can see, so we can go ahead and start securing this. Specifically for ulnar gutters, I'll sometimes come and tape this stockinette to the splinting material. Just a little tiny piece of tape, one on each side. And that makes sure that this stockinette doesn't slip down underneath the bias while the patient is home. We'll start at the top of the hand here for our bias. We don't need a lot of layers of bias, just enough to hold the splint in place. And sometimes, depending on the length of the patient's fingers, you'll have to make a cut to accommodate this space between the index finger and the others. We don't want bunching between this index finger and the splint. We've made a few cuts. We're going to cover the hand. Between the thumb and the index finger, we're going to do an accordion with our bias. So you pinch on both sides of the bias here, gently fold it together, lay it flat between the thumb and the index finger, and then allow it to fan out on the top of the splint to cover any remaining web roll. And then we can finish our splint or our bias down the arm. And you just hold that for me. So we're a little short on the bias here, but assuming that we finished covering and wrapping, we're going to ensure that our splint is in the proper position. Again, this is by doctor's orders, but most of the time these fingers will be cocked down with the wrist slightly up. So sometimes what that will look like is thumbs at the bottom, fingers at top to push these down to their position. Then we'll hold until this cures. And that's the ulnar gutter.